Nursing care of newborn begin with assessment and stabilizing at birth. So you assign to do the Edgar score at 1 minute and 5 minutes at birth as a standardized method of evaluating the newborn adjustment to extrauterine life and identify any resuscitation needs. The 5 signs I will assess are heart rate, respiratory effort, muscle tone, reflex irritability, and the color. For each sign, I will assign a 0, 1, or 2 for an optimal total score is 10. Evaluate the baby heart rate by accosting at the expert of the neonatal stethoscope. A score of the 0 means heart rate is absent, 1 means heart rate is below 100 beats a minute, and 2 is above 100 beats per minute. To check newborn respiratory effort is observing the chest wall. 0 is mean respiratory effort absent, 1 is low or weak cry, 2 is good, means strong cry. Determine the muscle tone. I assess flexion and movement of the extremity. To do that, 0 is flaccid, 1 means there's some flexion of the newborn extremity, 2 means extremity are well flexed. Evaluate reflex irritability by gentle rubbing the sole of the newborn feet to elicit the response. 0 means no response, 1 means response it remains, and 2 means the newborn responds with the cry. The last thing is the infant color. 0 means it pale or blue, 1 means body is pink but the extremity are blue. This is acrocyanosis. So 2 means the extreme pink. After this assignment, I add all the scores together and reveal how to use the Edgar scoring to evaluate a newborn. Score between 0 to 3 is severe distress, require the resuscitation. 4 to 6 means moderate difficulty. 7 to 10 is a minimal or no difficulty, indicating that the newborn adapted to adequate of the extrauterine life. And to take care of the to assessment of the woman after birth, I have to assessment the location of the uterine fundus. Look at for the firmness, height in relation to the umbilicus, the position in the midline of the or deviated to one side. Vaginal bleeding should be dark red, no more than 1 bag saturated in 1 hour, and should not pass a large clot. Observing for the bladder detention, the woman often not feel urge to urinate because of the effect of anesthetic, perineal trauma, and loss of fetal pressure against the bladder. If her bladder is full, the uterus will be higher than expected and often displayed to one side. A full bladder can lead to the hemorrhage. And now I will instruct the patient how to take care, how breastfeeding and take care of the baby when she discharged. So the breastfeeding recommended for the first 6 months is will enhance the cognitive development, transfer maternal antibody, prevent some type of childhood cancer, and reduces the risk of the diabetes and childhood obesity. It also promotes benefit for mothers such as uterine contraction, postpartum weight loss, foster maternal and newborn bonding, bone density, and reduce the risk of breast cancer. It's also convenient and economy. And there's some type of the breastfeeding, like cradle hold across the lap, cross the cradle hold, football hold, or side lion position. When you feed the baby, one hand to hold the breast, then rub newborn lip gentle to your nipple and surrounding areola. To take care of the baby at home, you wash the face and the bottom daily, but daily full body wash not necessary. Do not immerse baby in water until the umbilical cord fall off. Dress baby warm, 1 or 2 more layers, and keep room warm when changing. Make sure baby sleep in the bassinet on his back, no toy or stuffed animal or pillow around her bassinet. Baby should produce at least 6 wet diapers and 1 or 2 stools with a day with breastfeeding. With the formula, you can expect 1 or 2 stools in 24 to 48 hours. So you call the doctor if the baby has some symptoms like diarrhea, fever, difficult breathing, or refill or difficult feeding, or less wet and soy diaper than expected. The feeding time is at least 8 times in 24 hours and 15 minutes each time. And you can wake up the baby if necessary, even though when the baby is sleeping. And then for breastfeed, taking care of your breast, you have to empty each breast during feeding to avoid the soreness and the engorgement. Alternate breastfeed and take note of which breast to start for the next time. So you have to burp the baby each time. You clean breast with the water only, no soap. Avoid the dryness and irritation. If your nipple sore, apply a few drops of breast milk after feeding and then let it air dry. Wear the supportive bra that's breathable, not too tight, and large underwire. Soft breast can be relieved by feeding, warm shower, heat or ice pack, or over-the-counter pain medicine. If you experience any localized pain, tenderness, or press, so call the doctor. And most important is your emotion change during afterbirth. So be aware of that and call a doctor if you experience depression that impede your caring or bonding with the baby, or you have a feeling of harming yourself or baby. And that's all my information. Instruct you for discharge a baby and take care of yourself at home. Thank you.